to Fit for Life. I'm Jordan May. I'm a physical therapist here at Ascent Therapy Clinic.
Hi, and I'm Macy Graham. I'm the wellness coordinator here at Ascent Therapy.
And today we're just going to talk to you a little bit about general physical health and wellness, how to take care of yourself as you're going through your day-to-day life. Sometimes we tend to scoot some of that stuff to the side, so it's best to take these little bits of information and throw them in throughout your day or your week, however you see fit, so that you can live your best and healthiest life. So mostly what we'll go over today is just some general flexibility, some balance, some strength, a little bit of cardiovascular endurance, and then finish with mind-body. And throughout any of this, it's best to refer to the Fit for Life packet that we've posted as a PDF. So please see that, and then there will be some contact information at the end of that as well. So if you have any further questions, you can stop in, give us a phone call, or come in for an evaluation and we'll take a look at you. So to get started, we're going to begin with just some basic flexibility. Typically, we often find ourselves sitting, as we are now, through our day-to-day lives. Whether that's driving to and from work, we might sit when we get to work, or we might just sit in front of the TV when we're coming home from a long day. So oftentimes we find that we've got some hip flexor tightness in through here. So we're going to start actually with the Thomas test. So I will demonstrate, or I will kind of walk you guys through how to do this. Macy's going to be our helper here, model. Yes, better word for that. So first I'll have her start on her back. And her legs are actually going to come off the end of this here. And so what we're going to look for is hip flexors right through here. So when we sit, this muscle is often shortened, and most times it can be very tight. So what we'll do, and Macy's not always the best example because she's super bendy. So I'm just going to bring this one leg up here, and you guys, what we're looking at is actually the leg that's laying down here. So at home, if you're doing this, you can do it off the edge of a bed or a couch, wherever you can get enough room for your leg to dangle. You're looking to see if this feels tight through here and if this lifts off. If that's the case, then you know you might have some hip flexor tightness. The greatest thing about this is you can turn it right into a stretch. So Macy can just grab onto her knee herself, and now she is actually stretching through this part of her hip. Best to do it on both sides. You probably have some asymmetry between your bodies, especially depending on what you do for a living, but hold it for about 30 seconds to a minute in terms of stretching, see how long you can tolerate it, and then switch to the other side. Next stretch is just a passive straight leg raise. So we're looking at the length of a hamstring. So if you have Macy scoot back here. Now we probably know that by bending over we might be stretching our hamstrings doing this kind of movement, but what we're actually doing is mostly stretching through our back. So this is why I like to lay on your back so that you're getting the stretch through your hamstring rather than through your lumbar spine. So bringing this leg up here, notice I have this foot pulled back into this direction here. You actually might feel some of this through your calf as well as your hamstring. So you can play around with this stretch just to see where you're at. But ideally, if you're anywhere underneath 45 degrees, that's a case for you needing to stretch. So we'd like you to be in and around this 90-degree area. But if you feel a stretch through here, you might feel it mostly through there. So back off on that a little bit, and you can just pull this part of your foot up and stretch back through here. Do you feel that stretch there, Macy?
Mm-hmm.
The one thing I want you to avoid is you might feel some tightness like right behind the knee. In that case, might be worth visiting a PT just to get some further information on that, but that's indicating some neural tension. So ideally, it'd be best to feel it behind the thigh or behind the lower leg into the calf. Again, 30 seconds to a minute for that stretch, both sides, and you can go back and forth and do it more than once if you're kind of going through this progression. And then the next one's for the upper body. So I'll have Macy sit off the edge of this guy here. Okay, so from this angle, I'll kind of show you from the front. We're going to do what's called an Apley scratch test. So right here, seeing how much mobility we can get. But from this side, let's have Macy go one on top and one underneath. So again, she might have super flexible shoulders, and this isn't the case for everyone, but this is a good indicator of how much external rotation or internal rotation you have. So oftentimes a super functional movement as well, coming up underneath for taking off bras or whatnot for the ladies, and then just washing hair, washing your back. So basic functional movement that you need to be able to do. And then switch, looking at both sides. So as you can see, you might again have some asymmetries here. So Macy does. She can reach a little bit better in this direction versus the other direction, but that's completely normal, especially depending on what handedness pattern you have. So in order to address some of these tight areas, you can go ahead and relax, Macy. We've got 4 exercises listed here, and I've kind of gone through a couple of them, but there's 3 more that we haven't really targeted. So the wall latissimus stretch, and you can again find these right here in your program. So there's 4 of them there, and just refer to these 4 to address those pieces, okay? If you have any questions, again, feel free to call, come in and ask us as you need. All right, now moving on to balance. So as we get older, we tend to lose some of our balance, and we rely on 3 basic systems for balance. Number 1 being our vision, and that's throughout our whole life, and we rely more and more on that one as we age. Number 2 being proprioception, so that's basically our feet telling our body where we're at in space. So if your foot steps on some sort of a rock or an uneven grassy surface, it'll respond by telling your brain, I'm on an uneven surface, I need to be able to move my ankle, my hip, or my body however I need to in order to prevent from falling. And then the last is vestibular. This one's probably the most under-recognized area, but very, very important. So basically you have 3 semicircular canals within your inner ear. And if at any point you have maybe some sort of a huge impact to your head, or you have been on IV antibiotics, you might find that your vestibular is thrown off. So if you're dizzy with rolling over, or you get dizzy riding in a car, or whenever you're trying to read and you're walking, like anything that's requiring your eyes and your head to be doing 2 different motions might cause your vestibular system to flare up. Here's an easy way to test your balance. So the first position that she's going to take is the tandem position. So she's just going to stack 1 foot in front of the other. Now, throughout this whole progression, you're going to hopefully hold each position for 30 seconds. If you find that you're unable to hold for 30 seconds, this is an indicator that you need to work on your balance. So Macy is able to obtain that position pretty well. Now, if she's wobbling and weebling, that's kind of when we know that she's struggling there. So now I'm going to have her fold her arms across her chest. And if she's comfortable there, then next is to close her eyes. Again, taking vision away is definitely going to make it a much different exercise and a much more challenging piece to do. So she's wobbling just a little bit, but she's not falling over, so her balance is actually pretty decent. And then you'll want to switch sides on this. So you want to put the other foot in front. Because again, we have some asymmetries, so if you have a leg that tends to be weaker than the other side, then you might find that if that leg is in back, then it might be a little bit more challenging. So cross your arms again there, and then close your eyes. Good.
It is a lot harder.
So it looks like she's a little bit more stable on this side than she was on the other, but both sides are pretty darn good. So if that's easy, no problem standing there like Macy did, then you're gonna progress to lifting a leg. So we come to 90 degrees with that one side, and you're gonna hold this position. If this is easy for 30 seconds, no problem. Then we close our eyes again.
And something I just want to add too, so it is easier to start looking at the floor. So when your eyes are open, look at the floor first, get your balance, and then maybe try and look forward. And then you can, close your eyes from there and cross your arms. That's helpful.
Yes, gaze is huge.
Yeah,
for sure. So if you find that any of these are difficult, the best way to train it is to actually work on it. So balance never gets better until you force yourself to be in an uncomfortable and unsteady position. So just like Macy does all the time with yoga, you're consistently putting yourself through these static and dynamic positions so that you can work on your balance to get it better. So the best way to train, if this tandem position is difficult, stand in a corner so that you can, catch yourself if you need to, or stand in between two different countertops so you have some protection there. But best way to really challenge it is to force yourself to work on it. So at least ask someone around to watch you too if you need to. Now we're moving on to core strength. So a good way to test core strength, right in the abs.
Really important for all movements. So the stronger your core is, the better your balance is going to be, the better you're going to be able to walk throughout your day without low back pain. Core strength just ties to every single other aspect of this program.
And I always like to use the term, if you have a good strong core, your extremities are going to be able to move and function better because they're moving from a solid base. If your core is weak, then that's when you find that you lifting things away from your body is where we get into trouble, especially with our low back. And that tends to be something that comes up more often than not because we find ourselves sitting, and low back things are pretty common, especially after we've been sitting for a long period of time. So core strength test. So I'm going to have Macy on her back for this one. Knees are going to be bent so that we can put her pelvis into what we call a posterior pelvic tilt. So she's going to actually kind of have her spine all the way extended along the bed here. So then her hands are going to come right behind her head. And you're not going to crank on your neck. We don't want to be pulling or anything there, but your gaze is going to be up at the ceiling. And instead of bringing yourself into like a full crunch, like that, where you're cranking on the neck, you're just going to leave your eyes there at the ceiling, and then your chin's going to go straight up towards the ceiling as well. Lifting the shoulder blades off, so that's key. Do you see how, this is a perfect shot here. You can see how her shoulder blades come right off the table and then back down. So with this test, your goal is to be able to do as many as you can in a minute. So you're testing your endurance to see how many repetitions you can get. And there's a reference as to like where you should be for your age range that you can refer to here on this packet. So again, just making sure you're not cranking on the neck. I think that's the most important piece of this. So if you find that you are a little bit lower in terms of where you should be on this scale, a couple of great exercises that you can do in order to target this are the supine drawing, the dead bug, and the plank. So you can actually use this as an exercise here, but there's 3 other ones that we really like. And again, you can see those here at the end of the packet in the core strengthening exercises. My personal favorite, is the plank. Make sure you're engaging all of those muscles, forcing your shoulder blades to come down and in, squeezing your glutes, pulling up your quads, and having a nice, good, stable base as you're in that position.
And something that's really common with core exercises is wanting to hold your breath. And you don't want to hold your breath. You want to make sure that you're breathing, taking deep inhales and exhales. You can talk about bracing a little bit too, but I think the most important thing is making sure you're not holding your breath and breathing.
And breathing is a huge piece of core strengthening as well, because we all find ourselves breathing through this part of our chest rather than through our belly. Yeah. So, and we'll talk more about that towards the end when we get to mind body. Mm-hmm. Upper body strength. So with a push-up test, this is a good way to start if you feel like your push-ups might not be able to be completed on the ground. Especially if you've had any upper extremity injury, might be best to start on a higher surface, like a countertop or a couch or something that's about this height. So if we have Macy place her hands on the edge of this, I'm just going to kind of hold this table. She's going to get herself into that basic plank position that we just kind of talked about, pulling shoulder blades down her back, and then making sure that her neck is in a nice straight position with the rest of her back. Hands are about shoulder distance or just a little bit wider than that. And then as she comes down into her push-up, she's going to try to leave her elbows fairly close to her body. She doesn't have to exactly pinch because that's going to put more into her triceps, but you don't want to get way too out wide either. So her shoulder, the front of her shoulder is doing a really good job at not collapsing in.
You don't want this.
Good. And then maintaining that good core position like she was just doing. So the whole body goes. Don't let your rear end take a break. Okay, so again, with this one, you're doing as many as you can in a minute, and then you can compare these to what is on this chart. And to get the true comparison, these were performed on the floor. So if you feel like this is too easy for you, you can progress down to the floor and compare yourself with these charts. But in terms of exercises, in order to train this part of your body, basically the same way that you test it. You try it in these different positions, and the better you get, if you can perform 10, 20, then maybe you start to move down to a lower surface height. But I definitely would start from something here or even against the wall, so that you're using the wall almost as the floor, but you're not having to work against as much gravity there. Anything down there? Alrighty, moving on to lower body strength. So,
I'm just gonna stay right here.
yeah, that's perfect.
Okay.
So to assess lower body strength, this is one of the most functional pieces of our day. We do it all day long without even thinking about it. Getting up off of the bed in the morning, getting onto the toilet, getting off of the toilet, in and out of our chair at dinner or lunch, or in and out of our car. A basic functional squat. So we'll have Macy show you exactly what that looks like here. So what she's going to do is kind of just start by getting her hips to hinge backwards. And that's one of the hardest pieces, is to start that hip hinge, and then you start to drop down. And notice how as she drops down, her chest stays up so she doesn't lean so far forward. Because the further forward you lean, the more pressure you're putting into your knees, and the less that you're staying on your heels. And when you're moving your weight forward, more of it tends to be in your toes, and you're actually putting more stress on the front of your knees. And ideally, look how great Macy's getting down to about 90 degrees. So if you can get to that height, that's just about right. Some of us might be able to get lower depending on the range of motion that we have, but the stronger we get, the lower we're able to obtain.
Yep. I like, make sure with the core strength too, that ties in with squats. So kind of thinking of pulling your navel in towards the low back to help protect that low spine. So when you do go and squat, your abs are actually engaged too.
Yes, exactly. And to make sure you have a nice straight alignment of your back. So sometimes we find ourselves squatting like this with a round or too much of an arch.
Yeah.
So you want to make sure you have a good straight alignment here that's not too far in either direction. So I like the cue of pulling ribs down so that you feel like they're coming closer to your belly button, and then you're squatting down and back up, okay? So in order to train this, basically you can do the same thing there. You can also do wall sits against a wall. So prop yourself up against a wall, hold for as long as you can. That's really going to burn out your quads. I like the air squat to target more glute strength rather than just brute quad strength, because oftentimes we're quad dominant anyway. So it's better to end up training the glutes rather than just the quads.
Yeah.
So give those a try at home, and any issues or any pain, definitely stop, but let us know if you have any issues with that. Okay, then we're just going to chat a little bit about cardiovascular fitness. So heart disease is one of the biggest killers of cardiovascular disease throughout our nation, and arguably one of the most preventable things that we have that's causing some issues. So it's recommended that every day we take some sort of a walk, 150 minutes a week. You can break that up however you see fit, but just making sure we're moving. Like throughout our day anymore, we've become a society that sits a lot, and we sit for work, we sit for social activities, and less of our day is spent moving like it was way back when. So the more that we get our bodies moving, the better we're gonna feel, the better our metabolism's gonna work, and the stronger we're gonna be. And as we get older, all we want to do is maintain that strength, because without us even trying, it will start to diminish. So it's important for you to maintain that strength as best as you can as you continue to age. So there is a rock test on here that's called the Rockport walk test. All you're doing is determining how far a mile is. So you kind of just mark that out maybe you take a ride in your car and say, okay, this is how far this mile is, or you go to a track. You just set a timer, you see how long it takes you to walk a mile, and then you compare it to the same chart. You kind of know where you stack up, and then continue to walk almost every single day. So I try to walk in the mornings, or just to get some like nice meditation and some movement in for the day. So yeah, great way to walk, and it's very low endurance or very low impact, which is great for your endurance, especially if you've had a previous injury. If you have a lot of pain with walking, let us know. We'd like to help you with that as well. So finally, we're on to mind, body, strength, and this is kind of where Macy is best. So
yes.
I'll let her take over here.
Yeah, so I am a certified yoga teacher. We also offer Pilates classes here and low impact strength classes too. So those are other great options for you to find movement that you really enjoy. It doesn't have to suck. You can actually really enjoy finding movement, whether that's walking, biking, swimming, or coming to classes. Just find what works well for you. But what we really focus on as far as, especially in our yoga and Pilates classes, is the mind-body connection. So I talked a little bit about breath earlier, but breath is super important when you are moving, because the breath, they say in yoga that the breath is the bridge between your mind and your body. So what I like to do here, I'm actually just going to take a seat, and you can do this with me too if you want, Jordan, but you can just find just taking a couple minutes a day, or even when you feel stress, feel anxiety, being able to connect with your breath and connect that mind-body connection can help drop your body into a relaxation response. So this is really important to do first thing in the morning to start your day off right. Maybe before you eat, so you're in a mindful place before you're eating your meal, before you go to bed to help you sleep better. Anytime during the day that you feel like you need to just bring that connection back to yourself and drop into a more relaxed state, you can do this simple breathing exercise. So find a comfortable seat and just try and sit up nice and tall through your spine, relax your shoulders, and then close your eyes. So if you can, we want to just exhale all the air out, let it go. And then take a deep breath in through the nose if possible. And then exhale out the nose, down the throat. So it sounds like this. Inhale, full belly breath. Exhale, release. Inhale all the way to the top. Exhale all the way to the bottom. Inhale, let your ribs and belly expand. Exhale, release, and kind of pull your abs up and in. We'll take 3 more. Inhale. Exhale. Inhale. Exhale. One more inhale. And exhale. And you can slowly open your eyes. So you should already feel a little bit more relaxed, right? We're both smiling. Like it already automatically kind of brings you into this better feeling state. And all it takes is 5 to 10 breaths, and you can do it anywhere. Your breath is always with you, and you always have the option to connect with it. So what we like to do in classes, that's more of like a meditation type setting. What we do in classes is connect that breath to movement. So feel free to check out our schedule on the website and join us. Your first class is free, so join us for any of those.
Thank you so much for watching.
Yeah, thank you.
Hopefully we'll see you in here.
Yay. Bye.
Bye.